Okay, so we have Mr. Whaley. He's a 65-year-old man, came in with a history of COPD. He's had shortness of breath for the last 3 days. And he's also told us he's had a productive cough on and on for the past 2 years. He smokes a pack of cigarettes a day. He came in with some crackles in his lower lobes. His vital signs were 142 over 86. His heart rate was 102. Respirations were 32, and his temperature was 101.8. He had his O2 stat was 86 on room air. He went to the ER department. They put him on 2 liters of oxygen, but his O2 stat was still at 89%. The nurse went ahead and gave his oxygen on 4. Brought his O2 stat up to 95, but by the time he had gotten to the ER, he was not alert and oriented like he was when he got into the ambulance. He was somnolent. He was difficult to arise. So his vital signs then were taken, and they were with 138 over 78. Heart rate was 96. Respirations were 16. He still had 101 fever. His O2 stat was at 96 with the nasal cannula at 4 liters. So we did a chest x-ray, a CBC, some sputum cultures, and the doctor ended up ordering to keep his labs between 88 and 92%. They did another chest x-ray, some ABGs, some CBCs. We entered in an IV. They want albuterol nebulizer at 2.5 milligrams. We did inject, I did push some Solu-Medrol at 125 IV push twice a day. I have done one of those so far. She has had no side effects. I did educate her on the side effects and why she was getting it. They, respiratory therapy came in and did ABGs. The pH was 7.3. Her PCO2 was 58. Her HCO3 was 30, and her PO2 was 50. And her O2 stat was 96. So we did educate him on what was going on, that he has respiratory acidosis. And we did get a chest x-ray back, and it says that they're bilateral lobes. There are crackles in his lungs. So we're going to give those bronchodilators for sure. We are going to get some broad spectrum antibiotics and 2 inhalers and possibly to treat for possible pneumonia. We are going to send him home and let him recover at home. I did educate him on stopping smoking, making sure that he knows how to use his inhaler, he's using it properly, why he's getting certain medications. He was able to demonstrate how to use it, why he's getting certain medications. But other than that, he just had some rapid breathing, crackles in his lungs, and his last bowel movement was yesterday afternoon. So nothing really out of the blue other than just his lung sounds, which is normal for what he came in for. So other than that, he is good to go. He's just kind of hanging out, just waiting for his discharge papers.